Malignant Hyperthermia unit in Leeds is the only centre in the United Kingdom for the diagnosis and research into malignant hyperthermia. Malignant hyperthermia is a rare, potentially fatal complication of general anaesthetics. It occurs in approximately 1 in 30,000 to 1 in 200,000 anaesthetics, and with today's training of anaesthetists and the knowledge that we've gained over the last 45 years into the condition, it is fully treatable. With Richard Ellis's discovery of the muscle contracture test, which forms the basis of the diagnostic tests that we've used for 45 years, Leeds really has had a leading part in the progression of our knowledge and research into malignant hyperthermia.
The discovery of the muscle abnormality in MH, which was a rather important development, happened in 1970. I had an apparatus which we had built specifically for this purpose. Very simple apparatus comprising balsa wood and plasticine and bits of string, but it worked so that when the muscle contractured in the tissue bath, it made a mark on a smoked rotating drum and we could see the effect.
Well, my sister died in 1960, Patricia. Then 10 years after, Dr. Terrell and Professor Ellis came and they wanted to do some tests. My brother had a hernia operation and they did tests on him.
He very generously let the surgeon take a block of muscle from his thigh, and I brought this back to Leeds and put it into the apparatus which showed that the muscle was abnormal. So that was the first demonstration that halothane, which we knew caused the malignant hyperthermia reaction, did have an abnormal activity on the muscle.
As we have grown as a unit and we've investigated more and more patients, we really are able to do some unique research studies in Leeds that nobody else can do. We have investigated in a very systematic way so many patients, and we've been able to extend those investigations to family members.
Here in Leeds we hold the Malignant Hyperthermia Central Registry, which is a database of everybody that's ever been tested. I also hold every record on file of anybody that's been tested since 1970.
The overall aim of our research over the last 45 years has been to prevent MH occurring. And as we've had each progressive step in increase in technology of genetics, we've been able to make a significant change and step forward in our understanding of the genetics of malignant hyperthermia.
I came to Leeds for the testing, no problems whatsoever with it. You've got like a little scar which eventually fades. We're well looked after. We got a booklet afterwards to say what MH was. You got a phone number to call if you actually needed any help.
Usually I have just a chat about anything really, just try and make them feel at ease and know that we are here just to be phoned up at any time they want to talk, and they can speak to other patients that have been through a totally similar situation.
Meetings of the patient liaison group are quite informal, and we'll meet to make sure that we are providing the right information for patients in the right way, and that we are listening to the concerns that patients and their families have about MH. 25 years ago, we discovered that exertional heat stroke could be inherited in exactly the same way as malignant hyperthermia. We're now trying to investigate the genetics of exertional heat stroke.
My research at Leeds focuses on the genetic risk factors contributing to exertional heat illness, focusing on cases in the UK military, and we are looking for variations in their DNA that could potentially contribute to susceptibility of exertional heat illness. The main goal of the research in the future is potentially having a genetic test on entry into the military to hopefully stop cases before they happen. In the short term, we just want to explore the link between exertional heat illness and malignant hyperthermia.
And if we can find genetic markers for the condition, that means we'll be able to advise the military on whether their recruits are at increased risk or not. We've been fortunate to be successful in obtaining funding from major funding bodies in the UK, the Medical Research Council, the Wellcome Trust, the Department of Health, and with the assistance of the British Malignant Hyperthermia Association, funding through the National Lottery. Ultimately, our aim is to produce a screening test for any patient having a general anaesthetic, whereby we can identify whether they are at risk of developing malignant hyperthermia or not.